One of the advantages of studying the economic impacts of early Medicaid expansions on young children is that we can observe the long-term impact of those expansions now. So with my co-authors David Brown and Itai Lurie of the U.S. Treasury, we use administrative tax records to examine the impact of Medicaid expansions that happened in the 80s and 90s on children born from 1981 to 1984. And what we find is that those children end up paying more in taxes by the time they're adults at age 28 than they would have had we not expanded Medicaid to those children. And furthermore, they're more likely to be alive and they're more likely to have attended college, which seems to be good news for at least those early expansions in the Medicaid program. So I think that there's a general consensus that we think expansions in health insurance improve health. And there have been a handful of papers that have shown that in the short term, but it's just so hard to find compelling evidence of that in the long term, because you just need access to data following people over long periods of time. And so while the results are very intuitive, I think that we hadn't necessarily established long-term impacts of health insurance until very recently. There are certainly impacts that go beyond the impacts on the Medicaid eligibles themselves. We definitely see that people who are eligible for Medicaid as children end up going to college at higher rates, and it might be the case that our society is better off if we have more college-educated people. And it might also be the case that our society is better off if we have more healthy people. One of my early findings is one of the findings that surprised me most. In work with Heidi Williams, Doug Almond, and Joe Doyle, we examined the costs and the benefits of care provided to very low birth weight infants. And those infants are historically groups that require a lot of medical spending. The initial hospitalization can be upwards of $80,000. And there's also been increases in spending for that population. But we find that there are huge improvements in the mortality rates of those infants that seem to be well worth it in terms of what's actually being paid on their behalf. And that seems surprising because care on low birth weight infants is very high and it's increasing.